Welcome back to another episode of CareTalk with CVT. My name is Ron Ballecer. I'm the Manager of Marketing and Communications for California's Value Trust. And if you've seen some of our past episodes, we've talked about a program that's called Smart Care. Essentially what that is a suite of programs that are designed to do three things. Number one, save our members money. Number two, put money back in their pockets through incentive programs. And number three, be very easy to use. Today we're going to talk about one of those programs. This one is called Carrum Health. And to walk us through the program and explain how you could take advantage of the program is our Director of Strategic Initiatives, Jeff Cornelius. Welcome back, Jeff.
Ron, it's really good to be back.
So Carrum Health, tell me about it. What does it do? Why are we partnered with them? How does it help our members?
Great. Carrum Health is what is known as a Centers of Excellence program. Many may not be familiar with what a Center of Excellence is, but a Center of Excellence is a curated network of physicians and facilities that are the very best at what they do. And our partnership with Carrum Health aligns us with three specific areas of care for our members. So surgical centers of excellence, cancer and oncology centers of excellence, and then finally substance use disorder centers of excellence for those that may have need for intensive inpatient or outpatient substance use treatment. We've partnered with Carrum for a number of years now, and their suite of services has grown over the years. We started initially with surgical benefits and have grown into the other two verticals as well, so cancer care and substance use disorder.
So this isn't just about connecting our members with providers. This is really about providing them with the very best quality care possible. Is that fair to say?
Absolutely. So there are providers in every town, on every corner. Surgical providers, oncologists, even substance use disorders in many locations. What these programs do, and what Carrum has done in particular, is to curate a network of the very best surgeons, surgery centers, cancer centers, oncologists, and substance use disorder treatment facilities in the country. Really, the top 10%. So the best of the best, and make those available to our members as they have need for care in one of those areas. And it also helps to get members in for treatment, for care faster than if they were to use their traditional PPO network. On top of that, one of the reasons that we were immediately attracted to Carrum, in the market, let's say you had a need for a joint replacement surgery. In the state of California, the cost for that joint replacement surgery varies widely from hospital to hospital, ambulatory surgery center to ambulatory surgery center, surgeon to surgeon. There's no rhyme or reason as to why one might cost $45,000 in one location and $85,000 in another location. What Carrum does is they contract with these providers at a much lower rate in exchange for us sending our members to them for care. So our members are getting the best care available in the state or in the country at a much, much lower rate than they would through their traditional PPO network.
So I think there may be a misconception there, Jeff. Let's dig in a little bit. So this program's not about finding the cheapest provider, the cheapest physician to do this surgery.
No. This is about finding the best of the best, those that deliver the highest quality, the best outcomes, the fewest complications, and are willing to stand behind their work. So each Carrum physician warranties their work so that if there is a complication post-surgery, for example, they stand behind that work and they are at risk for future costs associated with any complications that arise. So no, this is not about simply shuttling members to the lowest cost provider. This is about helping members get to the best providers.
You mentioned surgical. What kind of surgeries does Carrum help our members with?
A wide range. But in terms of some of the larger categories, you think about things like musculoskeletal. So think about joint replacement surgeries. Maybe it's arthroscopic surgery for a sports injury on a knee or a shoulder or a wrist. Also includes things like bariatric surgery, spinal surgery, and even newer offerings around women's health. So think hysterectomies and surgeries akin to that as well. So there's a broad range, and that list of available procedure types is growing all the time. And Carrum is continuing to grow and curate their network to offer more avenues for our members to access care throughout the state.
You had mentioned cancer care earlier. Tell me about that.
Cancer is a difficult and very personal journey. And oftentimes, some of the best research taking place are at large research universities or cancer institutes. We have members that live in a lot of rural communities throughout the state of California. What Carrum helps us do is to bring the knowledge and expertise from those research universities and from the large cancer institutes to our members that live anywhere in the state, but particularly those that are in rural areas that may not have direct access otherwise to those sorts of resources. So in the state of California, Carrum has partnered with City of Hope for surgical treatment, so excision and radiation, and they also help coordinate with local treating oncologists back in your hometown after the excision and the radiation is completed, and your treating oncologist can work peer to peer with the oncologists at City of Hope. We also have members that access care at Memorial Sloan Kettering in New York, or at University of Chicago, two of the best cancer institutes around. So they offer a broad range of world-class, leading-edge research and treatment paths that all of our members have access to.
So Jeff, what about substance abuse? What does Carrum do in that area?
Well, like cancer, substance use disorder is very personal. It's very intense. And when someone is ready for treatment, being able to get someone to treatment quickly is really, really important. One of the challenges in a traditional health plan network is finding a treatment center that is in network. Many will say, yes, we take your insurance, but they end up, in the end, we find out that they're out of network, and a member often gets balance billed for the care they receive there. Carrum is partnered with world-class substance use disorder facilities. Think Betty Ford, think the Meadows, those sorts of facilities that our members have access to. And they can help get one of our members into one of those facilities in 24 to 48 hours. Sometimes a little longer depending on volume and need, but they can get someone in very, very quickly, whether they need intensive inpatient treatment or even intensive outpatient treatment for their care. There's no cost to the member, right? If they're on a traditional PPO plan, we waive all cost share for someone to use those facilities. They are, CVT is invoiced for that care, and we take care of the payment of that invoice on the back end so that the member is fully insulated and they can get the care they need without having to worry about, am I going to get a bill for this? Is this going to be taken care of? So we provide the care they need, we get them in quickly, and we take care of the financial piece on the back end so that they're completely insulated from that part of the equation. There's
that old saying that membership has its privileges.
It does.
And in this case, it sounds like it really does. Mm-hmm. So you had mentioned a bit about cost. How does cost impact a CVT member if they're going in for surgery, if they're going in for cancer care, if they're going in for substance use disorder?
Sure. So let's talk about two aspects of cost. One is what the member typically sees at kind of point of service. And then the second is what happens at the plan level, what CVT would pay for cost. So in our typical PPO plan designs, if you're on a plan like Plan 8, or Plan 9, or even the Bronze plan, where you have a deductible, and eventually you've got some co-insurance that plays in there, the member is going to be responsible for satisfying that deductible. Typically, if they need to get their knee replaced at a local hospital, they got to satisfy that deductible, and they may be on the hook for co-insurance as well for that episode of care. With Carrum, in order to incentivize members to use a Carrum provider, CVT waives all cost share. So if you've got a deductible or you are responsible for coinsurance traditionally, we take that off the table. So there's no financial barrier to entry to using Carrum for that care. The only exception to that really would be if you were on an HSA qualified high deductible plan. We're required by law that a member satisfy that initial deductible before the rest of the bill will be taken care of. But then we would waive any additional coinsurance for those members, right? Same thing is true with cancer care. The same thing is true with substance use disorder. If you've got a PPO plan and you have a deductible or coinsurance, we waive that. We take that off the table to encourage you to use these resources. So that's what the member sees kind of at point of service. On the back end, in terms of what is billed to the plan, I'll give you a real world example. I talked about kind of the price discrepancy on around a joint replacement before, right? Historically, when we would receive a claim from one of our health plans for a member that had a knee replacement, for example, yours might have been $45,000 and mine might have been $60,000. No rhyme or reason as to why. They're different. Maybe geography plays into that somewhat. But with Carrum, they negotiate rates up front with their surgical providers and their surgical facilities that they partner with. And that rate is known by the provider, that rate is known by CVT, and we've been able to prove when that claim comes to us after the surgery is completed, that on average, we're saving about 25 to 30% compared to that if that same experience had happened in the traditional Anthem or Blue Shield PPO network. So the member saves because they keep money in their pocket because we waive the cost share. But then the plan saves 25 to 30% on the back end as well by having that pre-negotiated case rate that Carrum negotiates with the providers. So everybody wins, right? And if we can get enough volume of patients that are using the Carrum door for surgical care, Ron, we could really move the needle when it comes to healthcare costs for our PPO pool.
Now, I would say that there's a third way that people win. I would say both sides win from the standpoint of the quality control being there. If Carrum's going through the rigor of identifying providers that have high quality, that have low readmission rates, that have low rates of having to redo the work,
right,
then that's less hassle, less money, less headache, less process for everybody involved.
Absolutely. Absolutely. Our goal is to alleviate financial burden, and then everything else that usually comes along with an intensive case like that, right? You've got all sorts of things that also play in, not just the cost and kind of the recovery piece, but it's like all that stuff that happens after the fact that we take that burden off of them as well.
So walk me through the process. Let's say I don't know if you know this, but I'm a bit of a weekend warrior, so I'm bound to have something happen at some point in time. Knock on wood. Let's say I need a knee replacement. What's my process look like?
So let's be real transparent. Right now, our Carrum program is fully voluntary. We don't force anyone through the Carrum door. So if you need a knee replacement, you really have two avenues available to you if you're an Anthem member, for example. One is the Anthem Blue Distinction Plus network to have your knee replaced. And then the other option is Carrum. And you really have to use one of those two options for the benefit to be covered. But we don't require anyone to use Carrum. But if you choose to do so because you know you're going to save money or keep money in your pocket from a cost share standpoint, and you really want to be a good colleague by helping the plan out and saving money on the back end for the plan, and you choose to go through the Carrum door, it's very simple to reach out and register with Carrum. Our member services team can help with that. Our account management team can help a member get connected and registered. And then that Carrum team will be your quarterback through the entire experience, right? From gathering medical records, because most people have had physical therapy and maybe some imaging done and maybe some lab work done to verify what's needed. Carrum will also have your case peer reviewed to determine, are you a good candidate for knee replacement, Ron, or are there less invasive options that are better for you? In fact, Carrum's global statistics show that about 30% of the cases that come to them do not necessarily require surgery, that there's a less invasive option that a member can can attempt before moving all the way to surgery. So we help members potentially avoid a really impactful procedure. But let's say you do need surgery. The peer review says, yeah, you've got bone on bone and that thing's got to be replaced. Carrum will continue to quarterback that care. They're going to look in your geography to find one of those top tier, top 10% providers and present you some options. Ron, here's where you're able to go within our network. And then from there, as you make the decision on where you want to go for care, they will begin the process of handling all of the logistics for you. All the scheduling. If there's pre-op lab or imaging that's required, they'll take care of scheduling all of that as well, all of which is covered as part of this case rate that Carrum negotiates. They handle everything for you. Now, you may find that there's not a Carrum Center of Excellence near where you live. That does happen. Doesn't happen frequently, but it does happen. Anywhere from 15 to 20% of the time, a member may need to travel to visit one of these premier facilities or surgeons. We have that covered as well. We have a full travel benefit in place with Carrum Health for not only the patient, but also your caregiver who's with you during that medical procedure, that medical event, right? All of the expenses are taken care of, whether it's a need for a rental car, gas, food, if there's lodging that's required, all of that is handled. If you're required to travel by air, the airline is completely taken care of. You never receive a bill for any of that. And for your incidentals, you'll get a gift card in advance to handle the incidentals for that stay. I'll give you an example. Our very first Carrum patient 3 years ago, turned out that for her particular need, it was beneficial for her to travel out of state. And I think she even went to Cleveland Clinic, if I'm not mistaken. Mm-hmm. When she came back, after her case was completed, she approached CVT and said, who do I talk to about what a great experience I had? These people rolled out the red carpet for me and treated me like royalty. I didn't have to worry about anything in terms of scheduling and logistics. I didn't have to worry about anything like travel. I didn't have to worry about anything but getting the procedure done and then getting well. And every one of our patients that has gone through the Carrum experience has had nothing but great things to say about it. So that's kind of soup to nuts what that experience looks like.
It's kind of like having a concierge at a fancy hotel take care of you.
It very much is a white glove concierge-like experience, which is unusual in healthcare.
Would you say that there are any misconceptions that members may have about this program?
I think maybe misconception might be not the right word. I think there's simply a lack of awareness that a member in CVT's PPO pool has access to this benefit. And as they become aware and as they learn more and as they start asking questions of our staff or of Carrum's concierge team, misconceptions evaporate, right? Because those questions can be asked and answered. And as we handhold them through the process, it clarifies a lot of things for them and helps them realize there's a lot of advantages to me as a patient from using this avenue to get the care that I need.
So between CVT's member services and the Carrum team, our members are pretty much held by hand going through the entire process.
Right. The goal is no homework, right? Make this as easy and as painless as possible, no pun intended, for someone that may have to be, cut open for a knee surgery or may need, complex cancer treatment or heaven forbid might need substance use treatment. No homework. We try and make this as easy as possible.
Sounds amazing and pretty much a no-brainer from where I sit. If I have to have the knee surgery out, I think I'm going to be going this route.
To me, I think it's one of the very best benefits that we offer. I mentioned earlier, most folks can get the care that they need near to where they live. Mm-hmm. In some cases, because of your particular case and maybe the complexities of your case, it may be required to travel. In some cases, you may be down the road of a prior authorization with Anthem, and things have to shift a little bit if you want to kind of move back towards the Carrum door. We've heard questions about how disruptive this might be, how inconvenient that could be if you're kind of down that path to some degree. I was talking to a colleague about this a few weeks ago and kind of sharing that concern that we've heard from time to time. And they shared this analogy. They said, imagine you booked a trip, you're on the plane, you're going anyway, right? Wherever it might be, you're going anyway. But you booked in coach. All you could get was a middle seat, right? And out of the blue, flight attendant comes to you and says, Mr. Ballecer, we have the opportunity to move you to first class. No additional cost. You can enjoy all the benefits of being up in first class. Doesn't cost you an extra penny. That's what Carrum does, right? So you could stay the route of your traditional PPO network and receive good care. But Carrum is the upgrade. Carrum is the first class.
So, Jeff, if you were going to leave our members with just one thought as to why they should be looking at the Carrum Health program for any of the things you had mentioned, whether it be surgical care or cancer care or substance use disorder, if you were going to leave our members with one thought overall, what would it be?
Well, so we have across all those categories, right? Surgery, cancer, substance use. We have thousands of claims in those categories each year. And we're paying what we've always paid on the PPO side for those claims to be paid, to be covered. There's a real advantage in an era where every dollar matters, and when premium costs are front and center in everyone's mind. It really matters to get people through this door, because it will save the plan a tremendous amount of money, millions of dollars, to be quite frank. And when we talk about trying to stem the cost curve, to try and minimize renewals from year to year, it's solutions like this that if we can get critical mass going through that door, we can start to really materially move the needle. And on top of that, you as a member, I as a member, any of our members throughout the state are going to keep money in their pocket. I don't have to worry about satisfying my deductible on the PPO plan. The worry about covering the co-insurance goes away. And I'm going to be handheld through this process the entire way. So it really is about the win-win for all parties by getting members to go through this door. Carrum's disrupting healthcare by the way they've partnered, the way they've contracted. This, our hope is, creates competition in the market. But it only creates competition if we get enough people using that door for care. So that's what I would leave with you.
Well, thanks, Jeff. This is super informative, a lot of really good information. I think you did a good job in covering all the high points. I think we've answered a lot of the frequently asked questions that we get about the Carrum Health program. If you'd like to learn more about Carrum Health, visit cvtrust.org/smartcare. That's it for today's episode. We hope to see you next time when we're going to talk more about California's Value Trust and how we can help you stretch your healthcare dollar.